got corona.
Yeah.
That would be good. That would be funny. But here we are. Welcome to the Corey Jones Show here on RVNTV.tv. I'm Corey Jones, owner and head instructor of Safety Man Security Consulting at safetyman.co. We do three things to keep you safe. The first thing we do is active shooter training. We'll come into your business, your school, your house of worship, a daycare, any place you have a lot of people, even financial institutions and banks. And we'll teach you how to prepare for, identify, handle, and recover from an active shooting event or any other unexpected, unforeseen, traumatic emergency. We also do taser and stun gun training and sales. I am a certified stun gun and taser instructor by the state of New Jersey and by Taser International. And we can train you to how to legally, morally, and tactically use a taser to protect yourself or your loved ones. And finally, verbal judo. Verbal judo's been around for about 30 years. They only have 11 instructors, and Corey's just been made number 11. We do corporate, law enforcement, medical, any place you have people and you want to be able to de-escalate and get your mission accomplished without having to resort to violence, contact Safety Man to get verbal judo training. So in light of keeping people safe, I'm with a good friend and colleague, Dr. Jordan Barnett. He's got so many different things other than just MD, medical doctor, after his name. I want you to kind of talk about, we're not worried about corona.
Yeah, we're not going to coronavirus here.
We're not going to get corona here.
Yeah, but we've been talking about getting a corona beer after this, with light of everything that's going on, right?
Indeed, with limes for vitamin C.
With lime, right, exactly, because the vitamins will help. Well, like you, I do three things also.
Okay.
So I actually am an actively practicing emergency medicine physician.
Right.
I am an educator as well. I am involved with both having established the EMT curriculum and the EMS curriculum with the Department of Labor's Job Corps program in Philadelphia, as well as all states career school. And I'm the medical director for one of the second largest EMS systems in Burlington County, which is Mount Laurel's.
Right.
So that's the second thing. And the third thing is I'm an entrepreneur and an educator.
Okay.
The entrepreneur side of things is I have set up a company years ago called EMS Consultant Group, and it actually provides management and EMS direction for private and municipal ALS and EMS agencies. We've even had projects as large as revamping the EMS protocols in Washoe County, Nevada.
Oh, wow.
So, three things just like...
Right.
You know,
and so for the lay person who may be watching, EMS stands for Emergency Medical
Services.
And basically there's ambulances that would show up to your house?
The ambulances, the first responders, and well, it's actually how you and I met as well. You and I initially met because Mount Laurel was instituting tasers.
Right.
And you were the lead instructor for the township, and I was the medical director. So we went on our dog and pony show, making certain everybody was safe with the use of tasers and nobody was getting injured. That's how we met.
And we were successful because in Burlington County to date, there have been no injuries as a result of taser application.
And everybody who is carrying them, who is in the 911 community, knows how to respond after a taser event has been, a taser's been implemented.
Exactly.
Yeah.
Exactly. So thank you for your help with that.
No problem.
Because that was very important to us getting that pushed out. So you've had quite a bit of training, and I know there's there's MD, MBA, FACHE, FACEP, and FACEPALM, FAAEM.
Oh my God, yeah.
So
basically it means I keep giving schools money, I guess, and keep going back for more education. So I'm a board-certified emergency medicine physician. I did my training at Thomas Jefferson University Hospital, which is a level 1 trauma center in Philadelphia. And from there, I subsequently ended up passing the boards for emergency medicine, fulfilling the requirements to become a fellow of the American College of Emergency Physicians, fulfilling the requirements for being a fellow of the American Academy of Emergency Medicine. But that wasn't enough, so for whatever reason I decided to go to Rutgers to get a master's in business administration.
Okay.
Why? Because I was running a business and figured I needed the background to understand how to make it more successful, and that translated that into a number of my endeavors.
Right.
So that's the MBA. Well, that's not enough. I have to go back to school even further. So I ended up taking the MBA in that healthcare education and ended up sitting for an exam to become a fellow of the American College of Emergency Physicians. That's where all those letters come together.
Okay.
So I think I could be accused of being a perpetual student.
Okay.
But
Well, it sounds like you retained the information, which is good.
I don't know if a certain professor who taught me accounting would agree, but that's okay.
Accounting's not the important part for what we want to talk about today.
Yeah, you don't want me doing your taxes.
So one of the things that jumps out is your major was biology.
Right.
One of your majors.
So yeah, at NYU, which is where I did my undergraduate, I was a biology major with a minor in chemistry, and I was working for New York City EMS. I ended up working pretty much full-time while going to college. There was some financial stressors while I was going to college in my family, and I was obviously, with that background, interacting with individuals in healthcare. So what do you do with a biology degree and an EMS background? Well, you could either go to grad school or you can apply for medical school. I ended up working for what was called a tactical unit out of Queens General, which meant you were covering pretty much anywhere in the county that medical command directed you to go to.
Okay.
You were sort of like a queen on a chessboard. You could move anywhere. The problem sometimes was that you ended up being moved into areas you were not familiar with, but you were an integral part for covering the emergency services, in my case, the borough of Queens. And it was a really exciting endeavor. I learned a lot, but it also helped prepare where I have come in my career in terms of having retained an involvement with being an administrator with EMS, a business leader with EMS, my involvement as an ER physician and an educator. Wanted to take all the skill sets that I have amassed over the years and share it with the people who I consider my brothers and sisters in healthcare and in 911. And I think I've done a good job with that.
Indeed, because I used to hear your name all the time coming up in the tactical unit as far as the SWAT side of it, and when we started working with the medics and giving them helmets and vests and having them staying in a warm zone when we went on jobs, your name, you probably had to sign off on some of those things and write their protocols on that. Yeah. One of the other licenses and certifications, I have a paper with a font about 6 that you gave me because you had to fit all of it on there.
Oh my God.
But one of them that stands out to me is the National Emergency Response and Rescue Certification for training in EMS operations and planning for weapons of mass destruction. Tell me about that.
So I was working for the Temple Health System at the time. This was after 9/11. I was the assistant director at the time, Northeastern Hospital, which was bought out by Temple, and I was assigned to be one of the individuals to get the training necessary to respond to a terrorist event if it struck the city in the future.
Okay.
So I ended up taking these courses with FEMA, so I would have the knowledge and the skill set to help direct that hospital and that portion of the health system if another occurrence had happened. And ended up with additional education along the way from other FEMA courses, including bombing instances and terrorism events, which were offered to me in my role with Mount Laurel EMS. As I already mentioned, Mount Laurel EMS is a very large EMS system. We cover the highway system here. We cover a large proportion of Burlington County, and also we're a suburb of Philadelphia.
Right.
So if anything significant were to befall Philadelphia, there's no doubt that Mount Laurel EMS would certainly be involved.
Well, if you remember, we had the Democratic National Convention in 2000, then we had the Pope visit, and we had the Republican one, and then we had the Pope visit also, which required all of us to put all kinds of different hats on at the same time to prepare for that. And fortunately, we didn't have any major events, but I know that your expertise definitely was helpful.
Well, if you take a look on that piece of paper with the 6-inch font, I was also involved as one of the individuals, one of the physicians, with the planning for the Republican convention for 911 response for the city of Philadelphia, and also for the visit of the Pope through Mount Laurel.
Right. So and now when you talk about WMD, weapons of mass destruction, we in our field sometimes use a different phrase called CBRN, right, which stands for chemical, biological, radiological, explosive, and nuclear.
Yeah.
One of those is biological, right?
Yes.
And that's a word, that's a genre that's becoming big in everybody's lexicon today, which is biological. And you've had training and experience between Temple, between Jefferson, between New York City, and dealing with different protocols. Can you talk about that?
Well, In terms of the training in those different capacities, EMTs do get some basic training in terms of responding. One of the first mantras that they talk about when they show up is to assure their own scene safety, and also to make certain that they are adhering to self-protection using personal protective equipment. Unfortunately, as ER physicians, between scares that have occurred over recent years with anthrax in the mail and scares where we've had biologic weapons set off in major cities such as Japan, the ER physicians have gotten training on that also, including setting up decon rooms and how to handle patients who might have been exposed.
Right.
I think that covers your question. As far as whether or not the education covers the myriad of everything that could be thrown at us in the future, of course not.
Right.
So one of the reasons that I keep being a perpetual student is you can't do this job without having to constantly keep your nose in the books.
Exactly.
So that's why you see all the 6-inch font there.
Yeah, and that's why I invited you on here, because this is something that a lot of people are talking about. And my goal is, I don't want to fight the situation with fear, I want to fight the situation with facts.
I'm glad you said that, because there's also a lot of xenophobia that's going on right now also.
Yeah.
You hear stories about how people are not eating at Chinese restaurants or considering people of Asian persuasion as being almost lepers.
Right.
There's such misunderstanding. And if anything, these are our brothers. We're all Americans.
We absolutely are. We're all humans. We're all Americans. And if that were going to be the case, that we're going to shun people from China, then that means you can't eat at any Italian restaurants, because there's a huge hot pocket
in northern Italy.
In northern Italy, where they attempting to quarantine 16 million people. So, you know, stop shunning, stop doing that. Practice our standard safe protocols, which we're going to get into a little bit.
Yeah.
There's one other thing I wanted to touch on. I was looking at from December 99 through 2004, you were with Temple Health System, and you helped restructure the health system with hospital closures, reorganization, and you had a lot to do with helping that. Can you talk about that?
Sure. I ended up taking on, I was brought on at Episcopal Hospital before it was bought by Temple as the deputy director. Unfortunately, within a few months of me going on board in that role, Temple took over. The nurses went on strike, and all of a sudden, the major department heads started to leave. I was reassured, hey, you know, this is going to blow over. They're just playing, you know, they're playing, you know,
dollars and cents.
Dollars and cents.
Yeah.
This is going to blow over. And all of a sudden, I discovered that the director was also leaving. All of a sudden, I ended up becoming the interim chairman, and I had to keep the emergency department functioning. The ER itself was in a pocket. Episcopal Hospital at the time was a pocket of HIV, heroin, knife and gun club. It was a bad area.
Right.
I had to make appeals up to Temple, Maine to address what was going on. I had to make arrangements with a number of the EMS companies that I incidentally had been working for to help move these critical patients out. So I was actually an advocate for the care of the patients in the community.
All right, Doc, apparently they're telling us we have to take a break.
Sure.
So that's a good cliffhanger to come back to see how this worked out.
Okay.
And then we're going to talk about Corona, COVID-19, and what you can do to keep yourself and everybody else safe. So we're going to take a break, be back in about 2 minutes.
Shelter dogs aren't broken. They've simply experienced more life. If they were human, we would call them wise. They would be the ones with tales to tell and stories to write, the ones dealt a bad hand who responded with courage. Do not pity a shelter dog. Adopt one.
Say we've got grit, and we'll take it as a compliment. Because it's our uncommon drive, our spark within, that brings us together and sets us apart. We are Temple made. And when others take shortcuts, when others take breaks, when others take the easy way, we take charge.
Add us on social media to watch bloopers, behind the scenes footage, previews, and more.
It's not my favorite beer, though.
No, it's not my favorite beer either. However, I want to hear how we took Temple when it was going through some challenges, and Dr. Barnett here did some things to help Temple get better. So can you finish that, please?
Oh, yeah, absolutely. So, as I already mentioned, I was an advocate for the patients and the needs of Episcopal Hospital, making appeals up to administration. Subsequently, Temple had made decisions that they were going to turn Episcopal into a freestanding ER with a psychiatric hospital attached to it, so they moved me over to Northeastern Hospital as the assistant director. And I was involved there with medical affairs and the events that we talked about, such as the Republican National Convention, the response to setting up a system in place in case of another terrorist attack, hence the FEMA training. And I was there for a number of years until I was offered the opportunity to go over to Women's Medical as the interim chairman when the hospital was rebuilding.
Okay.
Unfortunately, the hospital went bankrupt, and that's how I ended up at the hospital system I'm at now. But it also opened up the door for me to take on all these other endeavors where I can fulfill my passions.
And that experience had to be extremely beneficial to what you're doing now.
Oh, I learned from the seat of my pants how to be an advocate for patients. I learned P&L. I learned how to
P&L.
Profit loss. I had to make certain that the finances were in place for certainly for Women's Medical Center. I had to make certain that the needs of my staff were taken care of. It was a huge education by fire, thrown into the fire pan. And I'm glad that subsequently I got the MBA.
Yeah.
Because I kind of wish, retrospectively, I had that education to begin with.
Now, you put yourself into another frying pan to advocate for patients when you went to
Haiti.
Haiti. And tell me about that.
So I ended up making a really good friend at Rutgers. Her name's Rhode Malivert. She and I clung together when we were in the MBA program because the two science nerds were surrounded by all these fellow students who were all in banking and business, and we were scared. So my friend Rhode, who was Haitian, she and I basically, we went through the MBA program wonderfully because of the support we gave each other.
Right.
But as a Haitian woman, she has a lot of passion for her native country. She's a Haitian American.
Right.
And she's engaged or is dating a gentleman named Johnson Napoleon, who is a millionaire, who is an American as well, but Haitian born, whose interest is improving the lifestyle and the health of his fellow Haitians. So Rhode reached out to me and said, listen, Johnson has set up a nursing school, and he's planning a trip down to Haiti to provide care to the local clinics and hospitals. Would you like to come?
Right.
Immediately when I saw Rhode's email, I said yes, but I didn't think the whole thing through because it was also Haiti in July.
Right.
So I had no idea what I was getting myself into just from terms of the heat, but it was quite an experience. I mean, the people down in Haiti are wonderful individuals. They looked out for us even when our bus broke down.
Right.
The people there are in such terrible need. The country hasn't even recovered from a natural disaster that occurred years ago.
Right.
I would like to do it again this year. Unfortunately, I've got a issue that needs to be addressed, which I have to see if that could be resolved first, a little health issue. I've got some minor surgery coming up.
Okay.
But after that, if I'm well enough, I'm planning to go back down with one of the nurses who is running another program down there this summer.
So what I'm gathering, and this is why I invited you here, is you have the training, the experience, the accolades, and the real world immersion in places where communicable diseases can run around, where PPE, protecting yourself, is good, where advocating for the patient is good. You're a major in biology. So, of course, the big word, two words in everybody's mind right now is coronavirus or COVID-19.
Right.
And I wanted to ask you if you could kind of take us through quickly what I could expect if I call 911 at 1 o'clock in the morning and I think I have COVID. I have a cough, maybe I feel a little sluggish. the TV's been filling my head with all these different things, so I think I have it. What's going to happen?
Well, maybe I should take that from a different standpoint. Let's step back and talk about what exactly is this virus.
Exactly.
Okay, so unfortunately, you have to also consider that the news media gets viewership by creating sensationalism. And coronavirus is a classification of a number of viruses that have been around for a long time. There are 4 different types of coronavirus, and 2 of which were discovered in the 60s, but are basically the common cold. We have had some scares along the way with some other coronavirus. We've heard of SARS, and we've heard of MERS. Well, this most recent coronavirus is just another virus that has been identified, which did have its first appearance in China, and they believe it came from reservoirs of bats, from animals. The reservoir for a lot of these viruses is animals, and they go through an animal host that's been around for thousands and thousands of years. There just was a transfer to humans, and they believe it's from the wet markets that they have in Wuhan, China. So what ended up happening was, as people know from watching the news, one of the physicians in China recognized that some folks were getting pretty darn sick from this virus that was going around. And allegedly there was an attempt to quiet him, and eventually China clamped down and had a decent response by trying to contain the virus. But we've had influenza now going around for quite some time. People aren't scared of that. There's something like 1.4% death from influenza yearly, which kills children and adolescents and folks with underlying illnesses and the elderly. But 50% of folks don't even get the vaccine for the influenza. And there's Tamiflu. People aren't as scared. But now here comes this novel virus. What's a novel virus? The media never bothers to explain that. All that means is it's a new virus that they've identified. It's not a new virus that just came out of nowhere, which also created some of the xenophobia that it was a biologic weapon. It's not a biologic weapon. This is something that has been existing for presumably centuries. It's just these wet markets, which is where they have multiple animals in very closed environments where secretions and saliva and bloods can easily be transferred to humans, and they're eating animals that typically aren't domesticated. Those viruses got spread to humans, and now it's in circulation. I think the World Health Organization, as of today, declared it a pandemic, and all that means is now it's spread to each continent, but the word's very scary.
Right.
And so you've got the word novel virus, a word such as pandemic, and people start to think of zombie apocalypse.
Right.
These are very, very scary things, but there has been no decent attempt from a lot of the media outlets to explain what these words mean.
Right.
The vast majority of folks who get this virus are going to do fine, and we really don't know what the lethality rate is. The folks who tend to seem to be getting into trouble are the elderly with underlying diseases, such as heart disease and diabetes. Children don't seem to have much in the way of trouble with this. Pregnant women don't seem to have much in the way of trouble with this. It's just a small segment of the population. Now, does that mean that you should have grandpa go out to a ballpark with people sneezing and coughing if we have a number of cases in the area? It's probably not a good idea.
Right. And you shouldn't take him if there's in the middle of flu season.
Correct.
Either. Right.
And we have a bad flu season as well.
Right. Because you said there's 2 strains of flu out, right?
Influenza A and influenza B.
And they're still prevalent at this time.
Oh, I worked night shift the last 2 nights, and I can't even. I think I saw 60 patients over the last 2 night shifts. If I dare guess that maybe 20% of the folks we saw were testing positive, that probably would be at least
Testing positive for influenza.
Yeah. And these folks were coming in with rapid heartbeats, high temperatures, trouble breathing. At least one got put on a ventilator, and this is from influenza.
Right. So at the same time, coronavirus, COVID-19, SARS-CoV is running around. We still have influenza A, influenza B that are affecting people, potentially presenting similar to the layperson at home, right? But
Correct.
the media is telling them be worried about
Right.
corona. Flu, it's been around since you were kids, so
And
don't worry about that.
Right, and again, flu, you can get a flu shot many places for free, or for a couple of bucks at Walmart and at your CVS's.
Yeah, the urgent care.
Yeah, the
all
urgent
those
cares.
different places.
They're inexpensive. They're less than what, a Happy Meal and a cheeseburger at McDonald's.
Exactly, but people are ignoring that.
Right.
And then you also said now trees are beginning to bloom and foliage is blooming, so now we have allergy symptoms that are going to pop in. And I know my allergy symptoms present sometimes with a dry cough, a little bit of upset, not so much of a fever, but again, so now we're going to have 3 things potentially presenting.
Oh, yeah.
And one cause for it.
Right.
And like you said, 20% of your 60 patients that you saw were influenza patients, right? So hey, we're getting close on time. So tell me about what people need to do to keep themselves safe.
Well, first of all, there's been hoarding of masks. There's been hoarding of Purell. The reality is the masks serve as a barrier for folks who are sick.
To not get other people sick.
Not to get other people sick. Because the actual size of the virus is actually smaller than even the N95 masks. So the 95 masks actually serve as a shield to protect others. Wearing a mask is not really going to help you.
Okay.
It's good hand washing. Many people who sneeze and cough or even talk and particles get sprayed. So it has to do with personal distance, being aware that if you are sick, to protect others around you. Hand washing, the run on Purell, soap and water, I have to admit, the nurses, if they were here, would be joking and teasing. I keep Purell at the desk when I'm working at the hospital.
Of course.
But the reality is soap and water does a very decent job at eliminating the virus because we touch our faces all the time.
Yes.
So good hand washing, good hygiene. If you're sick, don't expose other folks. And this even applies to when influenza occurs. If you've got the flu and you show up to your accounting job and Mrs. Jones in payroll hasn't let out that she is starting chemotherapy for breast cancer, you're putting her at risk.
Right.
So it takes a degree of being a decent human being to help protect yourself and others.
So you would say, and I know we're right close to the end, the general public, the CDC has still been saying, echoing as of today, that the general public's level of risk of exposure is still low?
Very low.
It's still low?
And because we actually don't even know the denominator of how many people actually have the illness because testing is not rampant.
Right.
So that 20% higher mortality rate than the flu is probably not an accurate number.
I agree.
There are a lot of folks who might be walking around who are carrying the virus with no symptoms. So we have no idea.
You have a website that people can go to that they could, reach out to you to have you come speak for them and help train their people. What's that website?
Oh, that's where the marketing degree with my MBA comes in. I took my name. It's JordanBarnettMD.com.
JordanBarnettMD.com, spelled like it right is on the screen?
Yeah, just get rid of the space between Jordan and Barnett and get rid of the little comma there. And that's bring you right to the website. I actually have my lectures up there. I have all my credentials. And there's a contact page. So if I could be of any help to anybody, I'd be happy to do so.
All right, Dr. Barnett, thank you for being a friend. Thank you for being a guest on my
Always.
show. And thank you for keeping everybody safe. Come back next week for the Corey Jones Show. JordanBarnettMD.com.
Thank you. This was